Millions of people who need an ambulance often get stuck with a surprise bill. 13 Investigates helped expose this nationwide problem just a few months ago. And tonight, our Bob Siegel is back to explain how that 13 News investigation led to results and new calls for action.
Teddy Fedwall lives in Fishers.
No.
Emma Trendowski is 2 hours north in Crown Point. Different kids, different cities, same story. Both Teddy and Emma got sick last summer. Both needed an ambulance, and both of their families got a surprise.
We got a bill from the ambulance.
$8,470.
$9,076.04. It was shocking to see that it was almost $10,000 to take my child 37 miles from one hospital to the other that we could have easily done ourselves.
A recent report by the Public Interest Research Group shows ambulances transport over 3 million Americans with private insurance every year, and over half of those get a surprise bill. It happens months later when insurance companies deny coverage because it was an out-of-network ambulance, leaving patients stuck paying the balance.
That's outrageous.
And it's not supposed to be this way. 3 years ago, Congress passed the No Surprises Act to protect consumers from surprise medical bills. But ground ambulances are not included in that law.
Everyone knows ambulances are expensive. You don't get a choice. The ambulance that shows up, shows up. Why wouldn't it be covered?
The Fedwalls eventually resolved Teddy's bill by appealing to their insurance company. But when it came to the Trendowski's surprise bill, neither the ambulance service nor the insurance company would budge at all. That is, until 13 Investigates broadcast Emma's story. A few weeks later, her mom got a call from Superior Ambulance.
I have great news for you. You have a zero balance now. And I said, that's wonderful. And, is there anything else that I need to do now going forward? And she said, nope, you're good to go. You have a zero balance.
So what changed? Well, Superior Ambulance says for months, Anthem Blue Cross and Blue Shield refused to negotiate a fair payment until 13 News got involved.
After your story, Anthem reached out to us and said we'd like to negotiate on this particular case.
Kim Godden is a vice president at Superior Ambulance. She said the negotiation resulted in Anthem approving total payment of $4,521. That's nearly 5 times higher than Anthem originally agreed to pay. Superior accepted the $4,500 offer as payment in full.
The offer that they gave is really what all rates should be at all times.
But if the ambulance company is happy to get about $4,500 for an ambulance transport, why did it originally try to charge the Trendowskis and their insurance company twice that much?
Certainty. We'll take what we can get. If we could guarantee that we had a certain amount every time we transported a patient, then our bills would be less.
Godden told me ambulance companies often transport patients who have no insurance or who cannot afford their high copays and deductibles. That's why some ambulance bills are inflated to help compensate for patients who can't pay anything. But when Anthem and other insurance companies refuse to pay inflated ambulance charges and won't negotiate a more reasonable rate, unsuspecting families like the Trendowskis are caught in the middle.
The EMS system in the state of Indiana is very fragile right now. And this story brings to light, hey, why do we have to have news stories to get fair reimbursement? This is a bigger issue than this particular case.
At least for Emma's family, their ambulance bill is now resolved. Well, almost. After Superior Ambulance called to say this $9,000 bill was considered paid, the Trendowskis got another surprise.
And not even 24 hours later, I get a call from a third-party collection agency saying that Superior turned me in to collections.
So this still really isn't over with for you?
No, it's not. Just when you think it is, it's not.
Superior told me turning the bill over to collections was simply a mistake. Bottom line, instead of owing $9,000, the Trendowskis now owe only $636, the amount not covered by their insurance deductible. In the coming weeks, a federal advisory committee will send Congress a new report about ambulance billing. That report recommends lawmakers ban surprise ambulance bills. The committee recommends patients be charged no more than $100 for an ambulance, with insurance companies paying the rest. They also recommend ambulance and insurance companies establish fixed rates that will be fair for both parties. You can read more about the recommendations at WTHR.com. I'm Bob Siegel, 13 Investigates.